uh, I think it's a great to probably maybe have a slightly different topic today as part of the FIMA History of Islamic Medicine series we've been doing over the last probably maybe 10, 11 sessions. We've been focusing on the history of Islamic medicine from the physical side. But we know that Islam teaching through the Quran and Sunnah always care of the mental health as well as the physical health. And we know that a lot of, mashallah, Muslim physicians during the history, like Ibn Sina in his book Al-Qanun, also Al-Razi, they all focus on many aspects of the mental health. Al-Razi himself, he had a special ward in the hospital he established in Baghdad, looking after mental health. And there's many other hospitals during the history of Islamic medicine in Damascus, in Baghdad, in Cairo, also in Fas, in Morocco. They used to call it bimaristan or Dar al-Shifa, and many places focus and specialized in mental health, like Argon al-Kamili bimaristan in Aleppo. So today we're going to talk, inshallah, quite interesting topic on the practice of mental health in Islamic study. And I've got the honor to introduce one of the international figure in this topic, Professor Dr. Rania Awaad. MashaAllah, she is a clinical professor of psychology in Stanford University School in School of Medicine in the USA. And also she's a director of Stanford Muslim Mental Health and also the Islamic Psychology Lab in Stanford University. She's also president of Maristan, which is interestingly is an organization. It's non-profit organization looking after mental health service in the Muslim community. She's also the director of the Rahma Foundation, educating Muslim women and girls and giving lectures and halaqa, mashallah. And she's the faculty member of Islamic psychology in Cambridge Muslim College. Also, she is a senior fellow of Yaqeen Institute for Islamic research in the USA. And also, we should not probably maybe forget she holds certificate from Damascus, Ijaza on Quran and Islamic law. MashaAllah, she's multi-talent. And I'm not going to probably maybe make any delay. I'm going to probably maybe invite Dr. Rania, please, to start. And inshallah, after the talk, we'll be having a probably maybe session as well for questions and answer. Jazakallah khair, Professor Rania.
Jazana wa iyyakum. Thank you so very much, Dr. Sharif, and everyone who's here. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala al-hadi Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. Thank you so much for attending with us today and for this invitation, a very special invitation, alhamdulillah, on the history of mental health, particularly from the psychiatric and psychological background. So inshallah ta'ala, we're going to begin our presentation. I'd like to just share with you that inshallah we'll have some time for the Q&A, and you're welcome, inshallah, to keep us updated on those questions in the question box. But I'd like to, inshallah, now begin a little bit of discussion on the history of mental health from the Islamic history. And it is very important that we actually make sure that we have this conversation, because very often when we talk about Islamic history and Islamic history of medicine, sometimes psychiatry and psychology doesn't quite show up. And I think it's important that we correct that, because it turns out there's quite a bit of wonderful advances in the field from the psychological history. And this has been a lot of the work that I've focused on, and others more recently. And this work is part of what I do at my lab at the Muslim Mental Health and Islamic Psychology Lab. So before I begin, I would like to actually give my thanks to them. This is our website, and all of our publications, much of which I'll reference today, can be found actually on the website. You're welcome to follow us and follow our work, and also find those publications under the tab called Publications on the website. And you could actually access the many, many articles that we've written and books and chapters on these topics, inshallah. With that, I will begin, inshallah, with some definitions. When we think about the word psychology and we look at it from its Greek word roots, you see that the term psyche means breath, spirit, and soul, and logia means the study of. So really, in its origin, psychology had been once considered to be the study of the soul. And if you compare this to the Arabic term that was used traditionally, ilmun nafs, was also the study of the nafs, the self, or some people might translate it as the soul. And it's interesting that these two terms in its origin were very similar to one another. However, if you think about where we are today in modern psychology, you find a very different story. It is very much secular. It is shifted away from thinking about or incorporating anything related to the soul. It's become strictly rational, empirical, really focused only on the mind-body connection at best. And this is quite problematic for many people, including myself. I myself was not somebody who was at all interested in this field. When I entered into medical school, I had already completed, alhamdulillah, a good portion of my Sharia training. And I was already teaching in the community as a ustada. And it was a very last minute decision for me to enter into psychiatry residency training, which I did here at Stanford University. And I was very suspicious of the field, specifically for the reasons you see on the slide. I knew psychology, psychiatry to be a secular field, something that did not incorporate religion, and more often than not actually demonized religion. And I really did not know and feel what was my connection until, subhanAllah, my own work, which I started with here at Stanford, of looking at what is the history of Islam and mental health. There must be some of our early scholars that contributed to this field, but I had never heard about this growing up. All of the advances we ever heard about from Islam and medicine were surgery, ophthalmology, things related to even obstetrics, other forms of work in medicine, but not necessarily psychiatry. And I was so amazed to find then this term of ilmun nafs, which today in English we can translate into roughly Islamic psychology. This is the term that's used currently in the field. And very pleased to see that there was work done by so many scholars, some of whom we're going to go in depth with today, but they used the empirical and the rational. They didn't have any issue with this because we've never had a fallout between science and medicine, as you know. Such as other traditions, the Judeo-Christian tradition definitely had a fallout. We did not as Muslims. So we use the empirical, we use the rational, but in addition, we also use the scriptural, the Quran and the Sunnah, as sources of truth and sources of knowledge. And for that reason, the way our early scholars approached ilmun nafs is that they were able to take in the physical and the metaphysical. They studied the mind-body connection, but for them, it was the mind, body, and soul connection. And these are where some of the big differences are. And today, if I kind of jump through history here for just a moment to the modern day, this is where you see a big difference in why so many people in our Muslim communities today have trouble with modern psychology or modern psychiatry. They feel something is amiss, something is off, and they're right. There's something missing. And the missing here has a lot to do with the missing aspects of the metaphysical, the soul, this concept of whole body healing. Well, for me too, in my early days at Stanford, the first thing I did when I arrived for my training here at Stanford is I went to the libraries and I spent a lot of time pulling out resources and books of our early scholars. I had been trained to do so in my Sharia studies, and so it made sense to do so here. And part of my lecture today is really sharing with you a little bit of that journey. Professor Sharif has also shared with us a little bit about this term called Maristan or the bimaristans. And I want to just take a moment and share with you our latest work, because I will come back to this in my discussion of Balkhi, Razi, and others. This concept of the bimaristans, which is a Persian term, bimar means illness, and stan is a location. And so these were the locations where, or centers, institutions where people would go for healing. Many people might translate them as hospitals. They are more than just the hospitals. In Arabic, the term bimaristan is daru shifa. It's literally the center of healing. And it was more than just physical healing. There was spiritual healing connected to this as well. And you could see this in the beautiful architecture. You could see this in the lavish gardens that were all around, the flowing fountains, which were a trademark of every single bimaristan in their courtyards, and also the kind of treatments that they had inside. Now, I've spent my sabbatical in the last couple of years now writing this book, which alhamdulillah is just ready to be published. Here's the QR code of it if you'd like to follow along. But it's called The Bimaristans in Islamic Psychology, a historical model for modern implementation. And this is our hope, inshallah, to actually bring back this concept of holistic healing that the early Bimaristans and Dar al-Shifas had. By the way, the terms are interchangeable. In the Arab world, they tend to call it bimaristan, and in the non-Arabic speaking world, they tend to call it Dar al-Shifa. Funny enough, they're switched, but they're actually the same institution. And what's very amazing about these, ever since they started in Damascus, Baghdad, Cairo, and then spread all throughout the Muslim world, everywhere Islam spread, these institutions of healing spread with them. And where it's connected to the discussion of psychology today is that to our research, and this is what we write in the book, to our knowledge and research, many civilizations, including those before the Muslims, had hospitals. This was not new. But what was new was that bringing in psychiatric care into the hospitals, medicalized psychiatry, was new. This didn't happen before the Muslims, to our history and our research. And having specialized wings, wards specifically for psychiatric illness was new. You had surgical wards, you had internal medicine, you had, obstetrics, you had different domains, ophthalmology and such, but you often did not see psychiatry. And if you did, it was coming from a very spiritual perspective. But for the early Muslims, they saw mental illness and understood that this was an illness just like any other illness. And they were commanded, and this is what you'll see in some of the books, I'm going to quote this soon, the books of the scholars, they'll say, لِكُلِّ دَاءٍ دَوَاء, for every illness, there is a treatment. And so if we see psychiatric illness, mental illness in front of us, there must be a treatment or cure, medically speaking. And so this was one of the great advancements of the Muslims, and this is what our new book, alhamdulillah, is able to illustrate and give this credit back to the Muslims, because honestly, there's so much of the Muslims are written out of so much of history, particularly psychological history, as you'll see in my presentation today. Another thing before I move from the slide, in the Bimaristans, the Dar al-Shifas, what you see is not just medication. They definitely had that too. Most of the Bimaristans had pharmacies right on site where they were compounding medications, even growing the very herbs and essences that they were using on site. But then they also had talk therapy. And people are always very surprised by this, because we consider, as modern Muslims today, talk therapy of being a Western invention, a quote, white thing that people do that are not from our cultures. But actually, as it turns out, so many of the early scholars that I'm going to refer to developed forms of psychotherapy, of talk therapy. And sound therapy here, sometimes called music therapy, was also something they did excellent work with. One of our most recent papers that we just published actually gives the Muslims credit for using music therapy for the medicinal treatment of psychiatric conditions. Prior to them, the Greeks and the Romans and others had used sound or music and even instruments. And I know somebody is going to say to me, this is haram, etc. Here I'm talking about the medicinal use. Other civilizations used it for entertainment. The Muslims took the sciences of the maqamat, the tones, and used them for psychiatric treatment. And if you go to some of the still standing bimaristans today, the Dar al-Shifas today, such as those that are still standing in Turkey, used in, or even Cairo, used as a museum, you'll see areas that were for the orchestra to come in to actually help heal psychiatric conditions, such as, for example, depression, by playing a certain maqam or tone that would bring up the mood of a of a person who was depressed, or another tone would be played that would calm down a very anxious person. Very, very interesting, subhanAllah. And they didn't shy away from using any form of healing from any of the five senses. Also, art therapy, color, of course, the architecture itself had a significance, spiritual significance for healing. And so my hope, inshallah, as I'll mention at the very end of the presentation today, the current organization that I run is called Bimaristan, based off of these institutions. And this is my hope and dream, inshallah ta'ala, if Allah gives us success, to bring back this concept of holistic healing to our institutions, particularly our psychiatric and mental health care. Now let us turn our attention a little bit more to the overview of all the different types of scholars that contributed to what today we would call Islamic psychology. And when I was mentioning about pulling out the early manuscripts from the scholars in my training, this is on my off time, I would go to the Stanford libraries and just pour through early manuscripts as early as the 8th century, 9th century, 10th century. And I said to myself, somebody must have talked about mental health. Somebody must have done this. And I thought, well, psychiatry is usually housed in the School of Medicine. That's where I did my training. So let me start with the physicians. And of course, the most famous of the physicians is Ibn Sina in his Qanun, the canon of medicine. Next up would be Razi in his comprehensive book of medicine, and others. And sure enough, you don't have to go very far, because the early physician in the Muslim era would write their book starting from the head to the toe. And so very soon, I was coming across psychiatric conditions. But what was very interesting is that it wasn't just the physicians who contributed to ilm al-nafs. Excuse me. Ilm al-nafs was considered to be a very interdisciplinary science. So actually, the philosophers also contributed, the likes of Ibn Rushd and Al-Kindi and Farabi and others. And then you also have contributors from the field of what we today would call spirituality and ethics, or tasawwuf, tazkiyah. So you have the likes of Ghazali and Ibn Hazm and such, who are all contributing as well. And each one is writing from their lens. Each one is talking about whether it's body-based or soul-based, but they understand that there's an interaction between all of them. And so really, ilm al-nafs, we have to see it in the Muslim sense and Islamic psychology today as being very interdisciplinary. And if you lose any one of these categories, you lose a sense of what actually Islamic psychology is about. And that was very beautiful. Very soon, I realized, look at these great contributors. Let's take, for example, quickly, the example of Imam al-Ghazali, known to be, of course, a scholar, a jurist, a mystic, one of the greatest philosophers of Islam. And many of us are familiar with Ihya Ulumuddin, for example. But so much of his writing talked about the concept of that today we would have under the umbrella of mental health. Like when he writes about the alchemy of happiness. What is happiness actually? How do you achieve that point? How do you bring yourself out of a depressed state? And he talks about, of course, one of the most famous things of Imam al-Ghazali is the spiritual diseases, right? The amrad al-qulub and madkharat al-qulub. How do you purify one's heart and purify your soul? And I often say this point, which is very important, as a psychiatrist, practicing psychiatrist today, and for those who are psychologists or other mental health professionals that may be with us, so many of us use the DSM, the Diagnostic Manual for Statistical Analysis for Psychiatry, for diagnosing psychiatric conditions. But what's interesting is, if you look at the works of the early Muslim scholars, they had the equivalent of what would be depression or anxiety and other conditions, as I'm going to show you in a moment. But they also had the moral issue in their diagnostic works as well. So Imam al-Ghazali is talking about things like greed, avarice, gluttony, vanity, right? All the different diseases of the heart. And as Muslims, we would say these are part of the continuum of illnesses that need to be treated, though you won't find them in the DSM today. This is one of the core differences between Islamic psychology and modern Western psychology. The soul and moral-based aspects are left out of the equation, although you and I would both agree they need to be treated, right? So that's important, understanding the whole picture here. You have individuals who are on the physician side of things, like Razi, who is a famous physician scholar. And had a wonderful, I'm going to share with you a quick story about Al-Razi. Well, because when I talk about the concept of ihsan or excellence, you see this in their works. Razi this is, by the way, Abu Bakr Razi. There are two famous Razis in Islamic history. This is the physician of them. And one of the great things about Al-Razi is he was given the task by the leader of the time to build a hospital. And so he, with ihsan, with excellence, took it upon himself to do scientific experimentation to figure out where exactly in the city to put the hospital, bimaristans. And what he did is he took raw pieces of meat and put them all throughout the city. And then he would go day by day and mark in his book how the meat was doing, as in to say which piece of meat was going to spoil the quickest. And depending on where the meat spoiled the quickest, he then interpreted that this was the place in the city that had the worst air quality, and the place where the meat spoiled the slowest, this is the best air quality. And that is where he decided to put the hospital. And even before erecting the hospital, putting it there, and having himself, he became the director of the hospital, and having the other physicians work there, there was all this forethought about, I need to make sure that there's good air quality, that there's access to water, because they understood the concept of tuhur and tathir, right? Like basically purifying things with water, early concepts of germs, even before they could see them under a microscope, right? And also the understanding of all of this contributes to the health and well-being of an individual. One of our recent articles is actually about Al-Razi. I'm very proud of this article. It's published in the Harvard Review of Psychiatry. And we were able to give Al-Razi credit back for certain aspects, such as psychiatric aftercare. This was so amazing. By the time Razi comes around, there's been a few different hospitals already in bimaristans that have psychiatric wards, including his. And he has some wonderful books, such as, for example, the book called Mujarrabat, where he's basically detailing the treatments and day by day of the patients on his rounds. And he's talking about all the different kinds of illnesses in his hospital, including psychiatric illness. And one of the very interesting things about him is he institutes this concept of psychiatric aftercare, meaning once he discharges psychiatric patients from his hospital, he gives them 3 gold dinars. And at that time, that is a significant amount of money. And what that refers to is, and he says this in his book, and we quote it in the paper, he has 2 of the gold dinars, he says, should be given for food, clothing, and shelter for the person who's now being discharged from the psychiatric ward, because he wants to make sure that they're able to go back to their community with dignity. That they, after being in the psychiatric ward for an extended period of time, that they're able to integrate back into their community. And the 3rd of the dinars is for them to invest in a business so that they can become self-sufficient. So that when people come and ask them, where were you this period of time? The patient doesn't have to say, I was in the psychiatric ward. They have an ability to get themselves back on their feet without having to ask help from people around them. And this kind of foresight, this understanding of it's beyond the hospital walls. In fact, this is where we made the claim of the bimaristans were some of the first institutions to have social workers, people who took care of the affairs of the patient inside of the hospital, and upon discharge, figured out how to help them resituate back into society. This is so advanced if you think about what this all means. And this is, I will remind you, even though today's conversation is beyond just the institution of the bimaristan, happy to come back another time and talk specifically on that entire kind of concept and center. But remember, the treatment was free of charge. So not only are they coming to excellent treatment free of charge, because these were the awqaf, they were endowments that wealthy people and leaders invested in, but then the psychiatric patients were also given funds after their discharge. I'll pause here for just a minute because I'm going to go next to a very famous scholar that I'm going to spend some time on, Al-Balkhi. But before I even go there, I just want us to reflect on this for a moment. Many of you might be part of the NHS, and some of you are calling in from many different countries around the world. And it's interesting, even countries that have socialized medicine, meaning that you can access medical care free of charge, it is not to this level of ihsan and excellence. It doesn't have this depth of thinking and treatment. And if you're a little bit shocked and taken aback by how much work happened with psychiatric care, so was I. And this is, if you can imagine me sitting in the Stanford libraries as a young trainee trying to make sense of it all, I was so taken aback by so much of this and questioned why we had never heard and learned about this, even with Ibn Sina Razi, who many of us have heard about in our journey as just, being Muslim. Why have we not heard about these great connections with psychiatry? And some of that has to do with stigma. Some of it has to do with lack of knowledge around psychology and psychiatry. And some of it just simply has to do with the same way I grew up, all this internalized stigma of this is a field that's made by these Western, non-Muslim, European usually, forefathers of psychology, Freud and others, and it has nothing to do with Islam and Muslim. When in reality, they couldn't have gotten to where they were if it wasn't for our scholarship, subhanAllah, in the first place. So let me give you an example of what I mean. And this is where I'd like to spend a little bit more time speaking about a specific scholar that I've spent a good deal of time writing about. And his name is Abu Zaid Al-Balkhi. And he is from the 9th century. He's actually Razi's teacher. Razi was one of his students. And we have a number of papers about Balkhi, which again, the website, my lab's website has all of them there. But I'll share with you a little bit about his background so you understand who he is, because unlike Ibn Sina and Razi, he was much quieter and much more less well known. In fact, we couldn't even we didn't locate his most recent, or the book that I'm going to be speaking about today, until very recently. And so this is probably why he wasn't quite as famous, especially in the modern era. But he was from Balkh. Today we would call this modern day Afghanistan. And like anyone else in his era, this is the 9th century. So the seat of knowledge, the seat of ilm, is in Baghdad. So after studying at the hands of his father, he became a hafid of the Quran and studied all his, original formative Islamic knowledge, as they all did, as a young boy. But then he traveled to Baghdad to acquire the rest of his knowledge. His teacher was Kindi, so you can see the sanad here, for Kindi to Balkhi to Razi is kind of how it's going. And, he immersed himself in all the theological and philosophical discussions happening in the scholarship of the time. And he excelled in something called theoretical medicine because he didn't practice medicine physically the way Razi did. So it was very theoretical in his case. And he was a polymath, somebody who excelled in so many different fields and wrote. And the way they excel is they can write books in so many different fields. He wrote books in medicine, yes, but he also wrote in so many other fields as well. And actually, where he's most famous is not psychology or medicine, but rather geography. There's an entire school of geography named after Balkhi, the Balkhian School of Geography. And so for the longest time, people didn't even know there was a connection to psychology. Until the story is actually quite interesting. One of my mentors, who's now passed, rahimahullah, is Professor Malik Badri. And the story goes, another professor, maybe some of you are familiar with him, Professor Fuad Seskin, who was a German Turkish professor, was in the Hagia Sophia Library in Istanbul and was looking through an area of the library for his own field of work and came across Balkhi's manuscript, the original, but it was misplaced. It was placed in the wrong section, likely because Balkhi had written so many other things. They put his work in the wrong place. And when he read it, he realized this was very heavily psychologically oriented, but he wasn't a psychologist. And so he asked around who can interpret this. And it made its way to Professor Malik Badri. And this is how, subhanAllah, in just, a couple of decades ago, this is very, very recent, that his Balkhi's book was rediscovered. And the book is very interesting. It's actually called, let me go here quickly here so you can see it, and I'll go backwards. It's called Masalih al-Abdani wal-Anfus, Sustenance of the Body and Soul. And it's a 2-part book. And the 2 parts is because he talks about physical health conditions, and then he also talks about psychological conditions. And the book is split in 2 parts. And it's very, very, very interesting that he spent so much time with this. And let me share this quote with you from his book, where he says, "Religion is the greatest of philosophies. Therefore, man cannot be a philosopher until he becomes a worshiper. And the greatest medicine is knowledge, is ilm." And so a lot of these scholars, as they're writing, even the likes of Ibn Sina, they're quoting they're making references directly to the concepts in Islam. They're not devoid or it's not two separate fields. It's one thing. The concept of ilm, the concept of ibadah, being a worshiper, right, is very clear in Balkhi's writing and the like. Another thing about him is, and one of the reasons why we have, tried to figure out why did he not become so famous as the likes of Ibn Sina. Part of that had to do with his own personality. When he finished his studies in Baghdad, he returned back to Balkh. And when he came back, he was offered all these positions to become, very high status, to become a minister and so on. But he refused all of them. And the only position he would accept was a writing and research position. And he kept that same position until he was the age of 88. Despite higher salaries, despite higher status and such, he preferred to be very quiet. He had a group of students. That's how his works are continued. But he preferred not to be known. And that was just his personality. And this book I was referring to you about, The Sustenance of the Body and Soul, is also very different compared to other books written in his time and around his time. It's written in very simple Arabic. And he did this by purpose because he wanted the public to be able to access it. And I have the most recent paper I've written about Balkhi is something under the title of The First Self-Help Book in Psychology, because he literally writes it for the lay public. And in it, even the first half of the book, that's all physical health, there are all these preventative medicine type suggestions for people that they can self-administer. And even in the second half of the book that's on mental health, he's saying, I want to make sure people understand what these different cognitive and spiritual issues may be so that they can actually seek out treatment. And this is so interesting because he calls out other physicians of his era. And he says, shame on the physicians of my era. They write about physical conditions, but they neglect the psychological conditions. And I often think to myself, if Balkhi was alive today, he'd still be upset with us. SubhanAllah. Now, something very interesting about his work, as I mentioned, was the preventative care that he talks about. And he makes a very good point that if you can prevent illness from happening, it is better than having to treat the illness. So he talks about things like your home environment, clean water, clean air, protecting your body and your soul. And just like he makes references to physical conditions that people can understand. Well, if you're hot, take off a layer. If you're cold, put on a layer. He uses the same examples to then make the connection to psychological care. And he emphasizes things like very, very holistic nutrition, sleep, hygiene, exercise. Make sure that you're integrating healing from all of your senses. So again, the concept of music therapy, massage, aromatherapy, all being part of the treatment. And if you look at the book, the way it's split up, the first section is on physical health, as I mentioned, and the second half, Masalih al-Anfus, is on mental health and divided into 8 chapters. And here are some of the layout, just if you're interested to see like how these 8 chapters on mental health are laid out. He talks about sustaining the health, your mental health in the first chapter, mental hygiene and preventative care in the second chapter. Third chapter is spent talking about how do you regain your psychological health if you lose it. The fourth chapter, how do you, he actually talks about the symptoms, the psychological symptoms, and starts to distinguish. And this is very interesting. This is where we say Balkhi is one of the first, if not the first, to really understand the difference between psychosis and neurosis. What were neurological conditions and what were psychological conditions. Very, very interesting. And now the second half of the book, as in to say, the last 4 chapters are really what were very amazing to me. When I got to this section, I had first come across this work because I had read in Arabic Professor Malik Badri's Arabic summary of the book and was really interested. So when I went to go find Balkhi's actual manuscript, the one from the 9th century, this is all before anything was translated into English. And as I'm reading this, I thought, subhanAllah, look, he has a whole section on anger and what to do with it. And then fear, faza, phobias. And the next chapter was clearly around depression, right? And then the last chapter, chapter 8, is really where I was, the word would be floored. Really, I was amazed. I want to share with you at Stanford, where I trained, the forefather of OCD, obsessive compulsive disorder, was there. His office was actually just down the hall from my office. And He had just delivered to us the didactic lecture on OCD. He's also the person who's written all the textbooks on OCD. We had him at Stanford, and Stanford was home to one of the very, very first clinics ever on OCD. So imagine how proud they are of their OCD history. And this particular professor had just delivered a lecture to us that OCD was a new illness that was only discovered in the 19th century. Maybe a reference was made, in the 16th century, but there was no real work around its classification, diagnosis, and treatment until the 19th century. And here I am sitting in the Stanford Library, if you can imagine, reading this book, reading Balkhi's book in the 9th century. And here comes a chapter at the end of the book on obsessions. Yes, he calls it waswasa, and he makes some very interesting concepts. So let me explain what I mean by this. He makes a distinction that all people, all humans, could have a baseline level of waswasa. All humans have this. But some people have pathological levels of waswasa, and they need to be treated. So this, for me, was really incredible. And I was just sitting there thinking to myself, well, how do I tell my professor this story? So I'll share with you what happens next, because as I kept reading Balkhi's work more in depth, it was really phenomenal because it sounded like modern day medicine, what we would say in our medical offices to our patients. Even concepts like this first aid concept, where he would say, look, all of us have first aid kits in our homes, and you put your band-aids and you put your rubbing alcohol and you have your other things in this first aid kit. And he says, just like you have this for unexpected physical emergencies, you should have this also for your psychological emergencies. Yeah, and you should have a treasure trove, a box, a first aid kit of good thoughts, healthy thoughts. When you have happy days, you put your happy thoughts there so that when you have bad days, unexpected emotional outbursts, you can actually use this, seize these ideas. And I thought that was so special and interesting. He also talked about this concept of ishtibak, which is basically the concept of psychosomatic interactions between the physical, the spiritual, and the mental. And this understanding that you can't separate them out. The body, mind, and soul are all integrated. And so if you're going to treat psychological conditions, you have to treat it from all the interconnected aspects. If you just go from the lens of medicine and try to give pills, this isn't sufficient. And Balkhi makes this point in the 9th century. He also talks about temperaments and how some people are hot-tempered, some people are slow to anger, some people panic when they're terrified, others have the ability to stay calm. And the person who's working with the patient should figure out what the patient's temperament is and custom tailor the psychological intervention based on the temperament of that person, which I thought was fascinating as well. So back to my story about OCD. I went to the professor finally, and I think it's very, I find the best part of the story is actually his name, and not a Muslim. His name is last name is spelled Koran, Dr. Quran. Yes, very interesting. But if you look him up, he's written all these textbooks on OCD, and I finally managed enough bravery to go knock on his door and say, I think I found something here that's much, much earlier than what your textbooks and what you've taught us in class say. And at first he dismissed me completely, and he kind of waved me away and said, no, can't be. I read everything there is to read on the history of OCD. I am his OCD expert. And I said, I appreciate that. However, can you read in Arabic? And that's when he finally paused and said, no, can you? And what are you finding here? And I said, well, there's this 9th century scholar, Rania, a millennium of a difference, a whole millennium. And I think he has a very excellent presentation of OCD, similar to what we'd find in the DSM. And he was just amazed by that. So he said, fine, go translate this and come back. I did, sat there and translated this section, made a slideshow presentation for my professor and showed it to him side by side. Balkhi's criteria, classification, diagnosis, and treatment of OCD, side by side with the treatment classification diagnosis you find in the DSM-5 that had just been published at that point. And Professor Quran was just amazed. Like, he was literally jumping in my office for joy. And it wasn't because the same thing I was jumping for joy for, finding that the early Muslims had done such amazing contributions. For him, it was about science. He was impressed with the fact that there's a trans-historical understanding that this constellation of symptoms existed before the 19th century. In fact, it probably existed from the start of humankind, yeah? And also, he was amazed that there was work, and he literally said to me, this will overturn the history of psychology. You must publish this. And I wasn't thinking of publishing. I was just, like I said, on my own little personal journey. But he insisted. And so I actually got hold of Professor Malik and said, this is what my professor at Stanford is saying. What do you think? And he said, well, I'm looking at Balkhi from the eyes of a psychologist. You're looking at him from the eyes of a psychiatrist. Go ahead, publish, see what happens. And so we did. Here's the QR code for the first publication on obsessional orders in Balkhi's 9th century treatise. And it was published very quickly. When I came to write my second paper, that was on faza or phobias, that one took a significantly long amount of time. In fact, months and months and months, we didn't hear from the Journal of Anxiety Disorders. And finally, they wrote me back and they said, what you're claiming is so unorthodox, it will turn over the history of psychology. And we can't publish this until we have historians of medicine who look at what you're writing. I said, fine, bring your historians. And they took some time, they reviewed it. And once they finally came back with their results, they said in there, and I have their review of the paper, they said, this overturns psychology. I should actually tell you that it said, he overturns psychology, referring to me thinking I was a man. I just have to mention that because I think there's a bias in academic medicine and a bias in academia in general. But nevertheless, because it's a blinded peer-reviewed paper, yes. But nevertheless, it was very amazing to see that they were quoting specific historians of medicine, such as Barrios and others, who purposefully have left the Muslims out, or in Barrios's case, mentions the Muslims, but says all the Muslims did was translate the works of the Greeks, but they contributed nothing of their own accord, which couldn't be further from the truth. And so these are very gratifying moments, subhanAllah, of feeling like we've come full circle, of being able to say, not only did the Muslims contribute, they were the pioneers, they were the predecessors of this discussion. And so just in brief, as I want to leave some time for questions, so I'll just in brief tell you some of the great advances of Balkhi is not only classifying and diagnosing properly, but the treatments were phenomenal. So if you look at his treatments of OCD or of phobias, there you see 3 steps. Number 1, he talks about you must have the patient talk to a person who is trained and can guide them in how to get through this condition. And he's basically describing a therapist. And then he describes therapy. And very interesting, and this the reviewers caught this as well, that he describes forms of talk therapy. In fact, we today would call them cognitive and behavioral therapy strategies, CBT. And a very subset of CBT, as you might know, the treatment, the gold standard treatment today for OCD and for phobias is a form of CBT called exposure therapy, gradual exposure therapy. Balkhi in his book actually describes gradual exposure therapy and gives examples and tells you how to do gradual exposure therapy in the 9th century. Number 2 on his list, he says, and some patients will have a high level of condition, pathological condition, that they will need to take medication. And he tells you to take medications. And that was common at the time because they had the pharmacies, they were compounding the medications and such. And then number 3, he says, you must remind the patient not to lose hope in Allah subhanahu wa ta'ala. That if Allah has sent them an illness, He will also send them a cure. And here we have the hadith of the Prophet ﷺ that comes in, تَدَاوُوا عِبَادَ اللَّهِ. Seek out treatments, O servants of Allah, فَإِنَّ اللَّهَ لَمْ يَضَعْ دَاءً إِلَّا وَوَضَعَ لَهُ شِفَاءً أو دواء أو كما قال صلى الله عليه وسلم. Yani the hadith says, I'll translate, seek out treatments, O servants of God, for God does not send down an illness unless He sends a treatment or a cure in other narrations. And that is powerful. And here Balkhi is quoting this and saying the spiritual is important here too. Therapy, medications, spiritual connection. Very, very important. And you see a holistic concept within these early scholars that are writing about mental illness. And I hope we can come to this point here today. So as I close out, I'm just going to share with you that many people, Professor Malik Badri, myself, and others have referred to Balkhi as being a pioneer in CBT therapy. He was one of the first, if not the first, maybe, cognitive and behavioral therapist. He understood the idea of treating with the opposite. Anti-reciprocal inhibition is something that he talks about, being able to neutralize feelings, attaching positive feelings to negative experiences. And he also understood the Islamic orientation of the soul, that you need to have a connection with your Lord and not lose hope in the divine to see you through your condition. He also understood amazingly the difference between endogenous and exogenous depression. Endogenous originating within the body, exogenous or reactive, meaning from outside of the body, meaning environmental factors that lead to this point. And the treatments reflect this. Therapy, medications, and also bringing in the deen connection, right, is very important. And that's beautiful and how I feel it should be today in our discussion of mental illness and, of course, Islamic psychology. So here he was, a millennium before Europe and European advancements into psychology. You have people like Al-Balkhi and those who came after him, Razi and others. And he dismantles or attempts to dismantle social barriers to mental health. He talks about stigma and how it needs to come down. And he talks in very simple terms to the layperson, which I think is important in our discussion today. I hope this conversation around Al-Balkhi was interesting to you, or Islamic psychology in more general terms was interesting to you. And I hope if it's new to you that you continue to follow this work. I left some contact information for you on the slide, both my own and also my labs, and bimaristans, the nonprofit organization we've now founded. And I ask for your du'as as we continue this work and hope to bring it from research and theory into clinical practice and application. Alhamdulillahi Rabbil Alameen.
MashaAllah. Jazakallah khair, Dr. Rania. Fantastic talk. I'm sure you open our minds to many issues anyway, but definitely what you've said is almost going to overturn psychology, as you said, and reclaiming the narrative. We prove this in many aspects in the physical medicine, but now when we hear what's happening actually on the mental health and the psychology, this is great. I can see Dr. Radwan Khayat is actually raising his hand, want to make a little talk. Dr. Radwan Khayat is a consultant psychiatrist in Southampton in England. Please, Dr. Radwan, feel free to talk.
Okay. Assalamu alaikum wa rahmatullah. Dr. Rania, I'm exceptionally pleased with your talk. It's really, it is scientific. It's well researched. It's opened many doors, and we learned a lot from it today. So thank you, and I will promise to follow your work and some references and try to get your book as well. I think for us, not only to think about the history, which is, we are so proud of it, and I think you open our eyes to many aspects which probably we're not fully aware, and this the evidence that this omission of the Muslim contribution to the history of science in general, medicine in particular, and psychology and psychiatry in specifically, as you mentioned, I think it's an enormous omission, deliberate, systematic omission of Muslim contribution to the history of science generally, and you see that across all spheres of science. What I think I would like just to highlight some aspects, some point of what you mentioned, and also talk to many people who work in this in field of medicine who are listening to the talk today, that Unfortunately, we have a huge lack of knowledge about psychology and psychiatry among Muslims, and we have a major problem of stigma as well. We have oversimplification as well of mental health and the treatment of mental health, that it's all, if you have a good faith, if you are a good mu'min, you shouldn't have people talking, and imams and scholars, they keep talking about just if you are a good Muslim, you don't need to worry about mental health. I think there are major problems in the way we talk about mental health, and that lack of understanding, lack of seeking a proper help, and also we don't have enough Muslims who are specialized in psychotherapy, and that's why having culturally aware Muslim of the Muslim background, and there is now, as you refer to, we have more specialized psychotherapy currently, like cognitive behavior therapy and other therapies, with very good understanding of the Muslim. If I have a good Muslim with a specialty in psychotherapy or psychiatry and treating Muslims, I think understanding their background, their value system, and trying to use that for their benefit within the patient framework, not imposing on Muslim, but taking that, rather than what we see a lot of traditional healers and exorcism and other practices, which is still common in many Muslim cultures. So I think we need a kind of revolution in a Muslim community to take your words and take more interest in this field, to have more specialists in psychotherapy among Muslims, to take, not only be Muslim, to have that understanding, because I think if I have a good understanding, I can relate to my patient, I can help them, and and there is a good evidence that spiritual-based psychotherapy is more effective. And I think taking that into account will be very helpful. So, and I also quite feel very upset when people oversimplify the talk about psychiatry and psychotherapy, and when they don't follow evidence base. If you talk about any type of therapy, you have to say, what is your evidence? When Arazi was searching for a good hospital, he just didn't sit and just choose. He ran an experiment, as you said. He ran an experiment, an empirical experiment, and then when he chose the place for the bimaristan or the hospital, it was evidence-based. And I think that's what we should do nowadays when we talk about any aspect of spirituality, of something related to faith. We have to show the evidence for that. That's why we need enough expert in this field.
Jazakallah khair. Jazakallah khair, Dr. Ridwan. Barakallah. Do you want to comment, Dr. Rania, before we go ahead with the next?
I want to just thank Dr. Ridwan for his comment here, and I couldn't agree more. And I think the bridge between understanding scientific, this is what the point I was making, that the Muslims, even if you look at Ilm al-Nafs, they never took away the scientific experimentation, which we call empirical work, rational work, in addition to the revelatory. I see some questions that we might get to related to things like jinn and such. And so, you know, we are very holistic in our, have always been, as a tradition and a heritage, very holistic. And so we should never throw out the science part of things. This is my dream, inshallah, I'm hoping, to your point, Dr. Sharif, I'm hoping my organization, Maristan, kind of in building this new concept of the healing center and all the treatments within it, can show what this means of bringing the science and bridging it to the spiritual. They have to be together, and you can't leave one out from the other. And to your point, just very quickly too, if I can share the book that we've written on psychotherapy, I really appreciate your comment on, we need to have excellent psychotherapies that integrate spirituality in them. And in addition, they are also scientifically proven to be efficacious. With some colleagues, I've written a book called Applying Islamic Principles to Clinical Mental Health Care, introducing traditionally Islamically integrated psychotherapy, or the TIIP model, the TIP model, some people call it. For those who are in the mental health field, this is a form of psychotherapy that brings in Islamically integrated care. And it's an entire guidebook of how exactly to do this. There's trainings that go with it. And so I hope if you're not familiar with this just yet, to familiarize yourself with this form of psychotherapy, because we've done quite a bit of research on whether this is actually as efficacious as, say, CBT or DBT or any of the forms of therapy you might find today in the field. So inshallah, we can put a link to that in a moment.
Jazakallah khair. Dr. Alia, do you want to speak?
Yes, hi. Assalamu alaikum.
2 minutes, please, if you don't mind.
Yes, oh, put my video?
Yeah. Go ahead.
Okay. Okay, I'm starting the video. I don't know why it's, oh. Can you start it on your side? I can't, it's kind of stuck. Oh,
Just put your
now it's
question,
okay.
sister. Yeah.
Yes, basically, I just, this is so, I think your work is amazing. We've been basically a kind of like waiting for something as this, for an awakening in our understanding of psychiatric diseases. It's been a because it's really essential, not for Muslims, but it's essential for everybody. This atmosphere and environment of taking the soul out and the heart out of the equation has been detrimental for not just Muslims, but for the healthcare and the for all humanity. We as Muslims, we should be holding the torch for the emergence of this kind of work. So thank you so much. My comment for you is that also with tackling the subject of Islamic spirituality and the its major role in treating all disease. I don't think it's just psychiatric disease. I think we have that that was implemented by Muslim doctors with all diseases, even physical diseases, through spiritual practice. And but my comment for you is that I think you should incorporate in your work also that these amazing doctors like Dr. Balkhi or Razi or Ibn Sina, they were also not just scholarly. They weren't like just scholarly. They had their own spiritual journeys, and they had their interactions with the Sufi orders, and they had Sufi masters, and they followed the way of the purification of the heart and the path of excellence. That was, followed through the centuries, through the life of the Prophet and the Sahaba and all that. So we have to mention that. We have to mention the connection between the Sufi orders and their contribution and their walking that spiritual path. Like doctors, the psychiatrist or the psychologist, they have to also walk their spiritual path. They have to be embedded in that and practice it practically, rather than just knowing about it through research or through cognitive understanding.
Jazakallah khair, sister. Yeah, that's great. Yeah. We'll just allow people, if you don't mind, other people. You don't mind, Dr. Rani, we'll just take one more comment, and the answer you make probably maybe answer for both. Dr. Abdullah Bajabir from Kenya, I believe, also raised his hand.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Salam.
Barakallah feekum. Shukran, Dr. Sharif and Dr. Rania. This is really amazing, mashallah. And not to not to talk highly of Dr. Rania. I know she might be a bit comfortable, but this is what basically we need. We've been speaking about this, the balance between science and Islam, and this is most of the challenges that we have in it, even in our Islamic medical associations. You find someone who has gone very high up on the scientific work and speak authoritatively on the Islamic side, or the other side, an Islamic scholar, not bridging the gap between the two. I'm glad that we have talked about all these amazing chapters in Dr. Balkhi's work, and most of the chapters I've realized he's talked about the issues around spiritual care, or the deen part of it, and I like your last point that you said. He suggested that the meaning of happiness that we currently have, or success rather, to put it in different words, is not exactly, for Muslims, is not exactly what is in the contemporary context. And I would wish that even as we talk to our patients or relatives, or we let them know about this concept that right now the normal is being abnormal, if you know what I mean.
Jazakallah khair. Okay.
Yeah, shukran.
Barakallah. Jazakallah khair. Dr. Rania.
Yes, thank you so much to both comments. I appreciate them very much. And I just want to reassure Dr. Adia, you may have caught it earlier in the conversation, but the point that I made is all of these scholars are, what we mean by encyclopedic scholars is that they had themselves spent time, almost every single one of these scholars, when you read their biographies, you see that they were a hafid of the Quran. They were also somebody who had studied their own work in their own ilm, if you will, the Sharia sciences. These are the formative sciences before anybody takes on any work of philosophy or medicine or any of these other works that they took on. And then your point about that they continued their spiritual journeys is so important. I mentioned my newest book, the Bimaristan book, that is coming out in another month or two, inshallah, published by Routledge. But we've also signed on a new book with Routledge also, actually, which will take a couple more years to write. But it's specific to this concept of spiritual integration of the therapists themselves, the work we need to do for ourselves. So I'm pushing back on something in the field that I'm bothered by. And those of you who are in the field will understand. Today, it is very common for a physician, psychiatrist, therapist to prescribe mindfulness meditation, for example. And this is, hopefully you'll see what I mean by this, Dr. Adia, very soon, because for those of you familiar with mindfulness meditation, you might know that it's originally from a Buddhist tradition. It's secularized, and sure, it is efficacious. They've done quite a bit of studies. It's become evidence-based, as in to say that it works. I'm not pushing against that, it's working. What I am pushing against is that we within the Muslim tradition have our own form of meditation. We have our tafakkur and tadakkur and tadabbur that the Prophet ﷺ taught us, forms of dhikr and forms of meditating and forms of contemplative meditation that are actually, to my opinion, much more powerful, particularly if you're coming from a Muslim tradition. Otherwise, you're reaching into a Buddhist tradition or reaching for yoga into a Hindu tradition originally. Even if you sanitize it and secularize it, it is not our tradition. And so many, A, won't take it, and B, we are neglecting what you were saying, Dr. Adia, the path of even the person, whether they be the patient or the physician themselves, the therapist themselves, the healer themselves, needs to be on a path of their own journey, of their own healing. Otherwise, we have the saying in Arabic, فَاقِدُ الشَّيْء لَا يُعْطِي. Like, if you don't have this, you cannot give it. You cannot pour out of the empty cup. So imagine you are doing healing practices and psychotherapy and your life is a mess, or you're spiritually disconnected from Allah subhanahu wa ta'ala. As in to say, the healer has to also mend themselves. And so I couldn't agree more with you. And I hope, inshallah, you make dua for our newest endeavor. I've already received high criticism for this because the field apparently is not ready to hear that mindfulness meditation isn't the solution to everything. But we must continue to uplift our heritage and our work and continue to show that integration, and to the very first point that was made, show its scientific evidence and its efficaciousness with actual research. This is why I have a research lab on this topic. And to the second point, I want to agree with you very much. And I hope, inshallah, you'll continue to kind of follow this work and see that it's, and even join the work. I think there's an incredible movement that's growing. I'm very thankful for it. I'm a little worried. I'll say I'm worried because there's many young people coming into the field. Mental health has become much more popular than it used to be before. Despite the stigma, there's a generational difference, especially after the pandemic. There's many more people interested in mental health, but the field is not quite fully developed in Islamic psychology. It's like we're building the field as we're going along. There's a pipeline of people and we're building the pipe as it's going, basically. And so I hope, yes, more people come into this from a spiritually, religiously grounded and scientifically excellent perspective, inshallah.
MashaAllah, Jazakallah khair. I think I've got Dr. Majid Khatmi from Lebanon. He was practicing also psychiatry in the UK in some stage. Dr. Majid, please go ahead. Put your question, I think. You just need to unmute yourself, if you don't mind. Okay.
Sorry, Dr. Sharif.
Can you?
No.
Can you hear me? No.
Yeah. Go ahead, Akhi.
Aywa.
You've got 2 minutes.
Thank you
if you
very
don't mind.
much, Sister Dr. Rania. Allah bless you, reward you, and we need many 100,000 like you to go to every Muslim medical school to open the heart and the eye of our Muslim medical students before they grow up in the secular, immoral, agnostic way, affecting especially psychiatry. I was psychiatrist starting 1972 and I had early retirement. I moved to 3 TV, 3 radio, many thousand. So alhamdulillah, Islam for your health. Very important subject. I thank Dr. Sharif all the time. He opened my eye to see so many glory, discovery, i'jaz. 99.99% of Muslim doctors, Muslim medical students in the world, they know nothing about it. This subject should grow quickly to Muslim psychiatrists, to go to all Muslim medical students should go for da'wah conference to all non-Muslim psychiatrists and to show them the glory we have got before. But more important to me, we're all enjoying the past, the glory of the past, which is basic. And I thank Dr. Sharif. We should all know our glory past. Where are we now? Are we leaving our Muslim medical students to the West to be involved with all this nonsense in a lot of things about psychiatry? This should give us lesson how to organize a group, association, not Muslim psychiatrists, Islamic psychiatrists. So I hope we try to develop from this, inshallah. Jazakallah khair.
Barakallah. We just take one more comment and then we'll go back to Dr. Rania. Dr. Amin.
شكرا جزيلا دكتور شريف الشكر الكبير للدكتورة عواد على المحاضرة القيمة والشيقة فعلا التي تعكس قيمة الدين الإسلامي في تطور العلم والطب النفسي كمان زي ما تفضلت حضرتها. ولكن في عندي نقطة مهمة يعني.
Any chance in English, أخي, or we can?
Yeah,
please,
definitely.
You don't mind.
Definitely.
Barakallah, Jazakallah.
I'm really concerned regarding what we have been seeing in the last century, which is the Western people influencing the whole world regarding our past contribution to medicine and to psychiatry. We know that Professor Edward Said, he has written a lot about this kind of subject, how they have.
Okay. Jazakallah khair. Dr. Rania?
I think both
Sorry,
okay.
I think it's been muted accidentally.
Oh.
The speaker. I'm sorry for that.
No problem. Dr. Rania, you can
Yeah,
comment.
my question, there are of 2 points really. How we can influence the West to correct these kind of problems happened for the last century. The other thing I would like to ask Dr. Awaad regarding one of the major الكبائر السبعة اللي احنا بنسميها في الإسلام، وأحدها طبعا suicide. What is the Islamic religion looking at the people who have complications of depression or any other psychiatric problem which end up in suicide? Thank you.
Yes, of course. Thank you so much. I so appreciate both of the comments very much, and I agree with you. I mean, part of the reason I was even looking at all of the early manuscripts is because of my own. I came in, as I mentioned, very suspicious into the field, and my concern with all the young and new and up and coming people coming into the field, and those who've been there before, honestly, is that may I say something? I hope I don't offend anybody by saying this, but it's something I heard from also Professor Malik one time. He, as you know, he's Sudanese of origin, trained in the UK, and then he taught in Lebanon at the AUB. And when he tried to give this same presentation around the contributions of Islam and the early Muslim psychiatrists and psychologists to the field, they literally booed him out of the hall at the AUB. And he complained to his friend about what happened because his reception in America and in the West was much better. People were starting to understand cultural psychiatry and the importance of, the nuances of marginalized communities and such. And so they gave him a better reception. But in the Muslim world, in the Arab world, he was booed out. And his friend said to him, "Don't worry, Malik, Freud signs their paychecks." As in to say, sometimes our degrees, we get these degrees from these fancy universities. I am at one such university, and you put them up on your wall and you start to believe that what is taught to you is the truth, sometimes even with a capital T. And we forget, subhanAllah, that we come from an amazing tradition that needs to be bridged to the modern. I want to just emphasize that it's very important that we bridge to the modern and advances of medicine today, because the Prophet ﷺ has said, Al-hikmatu dalatul mu'min, that wisdom is the lost property. So people say lost camel of the believer. You take it wherever you find it. So if there's hikmah or wisdom to be found in other modern efforts, no problem in taking them. I want to be very clear about that. But that we do have our tradition that we take that we kind of must uplift and understand. And I'm worried about the new group of people coming in with their fancy degrees thinking that this is the only truth. And for the 2 comments that were made, absolutely, we do need to be in all of our fields, not just in the Muslim schools not just the medical schools of the Muslim world, but even of the non-Muslim world, as in to say everywhere this should be the case, literally overturning the history of medicine in general. And in my case, the history of psychology and psychiatry. So I hope you'll join this effort, because it's literally school by school, curriculum by curriculum to really start to make a change. I also want to share, there's a question here about suicide, and I really just want to take a moment to talk about that too. SubhanAllah, I did not see that my career was going to go in this direction, but somehow it did. Maybe it's because of the Sharia training originally, but this issue of suicide, I call the taboo within the taboo of mental health. It is very difficult to talk about. Yet, subhanAllah, my lab, and I have a whole there's 10 lines of research in my lab, one of which is dedicated just to suicide. And the reason for this is because I couldn't find anything out there that bridged the 2 worlds together, that talked about all the ahkam. I personally, my specialty in Sharia was fiqh. I trained in fiqh specifically, Islamic law and theology. And Islamic law, taking jurisprudence, being able to take our Islamic fiqh and all our morals, all our ethics, and then bridge it to the modern scientific understandings of what is suicide, what does it happen, where does it come from, what are your predisposing and precipitating factors, and so on, and bridge the 2 worlds together. My lab, alhamdulillah, created a very robust manual. It's 100 pages. A lot of heavy research went into this, about 3 years of writing, that created a manual on addressing suicide in Muslim communities. And then we created a training. And this is what I'm going to put for you in the chat box from Madistan, specifically about the suicide response trainings. In America, we have a campaign with all of our ai', the imams, ustads, ustadas, people who are on the front lines, training them. We've trained now 550 imams in America on how to address suicide prevention, intervention, and postvention. What do you do after the aftermath, unfortunately, of suicide? And giving them the tools, because they are on the front lines. People will go to an imam before they come to a psychiatrist to talk about their troubles. And you can catch this. So can families and parents. And I'd like you to take a look at this link if you can. And we're happy to take this training to other countries, other places. I was recently in the UK and they want me to come back and do this there. I was recently in Malaysia. Inshallah, we'll go back and do this training there. But it's very useful, I think. And we as Muslims should not shy away from anything. In fact, out of all the mental health conditions, suicide is preventable with the right knowledge and tools. So we have to stop sort of sticking our head in the sand and really be willing to come forward and talk about and not make any exceptions. The rules of Islam are clear. I'm not mincing the rules of Islam. The rules of Islam say, with full and complete wa'i, understanding of what a person is doing, this is haram. But in psychiatry, you have people who are not in their wa'i, not in their full cognition, and so the question of hisab is now to Allah subhanahu wa ta'ala. And what we need to do is figure out how to actually address that, the red flags. On the website, by the way, the Madistan website, you'll find khutbahs, a khutbah that is literally written about suicide prevention that you can download for free. It has all the rules of fiqh of the khutbah, but also all the scientific evidence properly put on suicide, so that in, say, September, which is Suicide Prevention Month, we hope that every khatib at least once in a year gives a khutbah around this topic, if that makes sense, and so on and so forth.
Jazakallah khair. Dr. Rania, I think we can probably maybe conclude here. It took a long time from your time. Anyway, it's a Sunday today. It's just would like to make very quick comment, because as one of the brothers actually mentioned, we try to probably maybe work with the grassroots as well. We in the British Islamic Medical Association, we started a new project trying to connect all the people interested in Islamic psychology. And also the FIMA, Federation Islamic Medical Association, just approved another project as well. Is led by Dr. Nabil Amin from Kenya also. I mean, this is called Save Mind. I'm hoping, inshallah, with your guidance as well, we try to get you involved, inshallah. I think that will be great if you promise us to do so, as today we really had a great time. And this talk, inshallah, as the brothers before me mentioned, this is open mind and open eyes as well to our great history, because we really need to change the narrative as a Muslim, and the contribution of Muslim physicians. Jazakallah khair. I mean, if you want to probably maybe any few words, if you want to finish, Jazakallah khair.
Barakallahu feekum. I appreciate you very much, Dr. Shiv. I know you really tried to make sure that this lecture happened, and I'm very thankful for that. And I appreciate FIMA very much, and of course, previously the work with BIMA as well. And I hope, inshallah, to be in touch with you based on the lab here at Stanford, the organization Madistan. I thank everybody for their contributions, the great questions that came through. I know some of which we didn't fully get to. I've been putting, just in case somebody didn't notice, in the chat box links to the various books and the various our YouTube channel, yes, and also the articles, the research articles, in case you'd like to follow up and read. There's, I don't know, over 50 publications or something around these topics. So if you're interested in, are academically inclined, you can find them there. The very last
website,
link,
is it?
It's all on the website, yes, inshallah. And the very last link that I put is actually a most recent, just on this topic of suicide, since it came up. I was asked by the U.S. Department of Health and Human Services to make a video by our imams here in America, probably the famous faces you are familiar with of the imams of America, to talk about this topic. So if you click on that, you'll see our recent work. It's only a couple minutes long, but you can see we're starting to make some bridges, even with difficult topics like suicide and mental health and Muslims. So please continue to keep us in your du'as. Please keep us in your prayers. And
Jazakallah
inshallah, we'll be
khair.
in touch with
Jazakallah.
them.
A great salam from Professor Salim Hassani as well, because we
Yes,
work
inshallah.
together as well, the FSDC,
Yes.
and inshallah we'll keep in touch, inshallah. Jazakallah khair, Professor Rania Awaad, barakallah fiki, jazakallah khair. Great talk and nice presentation. Barakallah. Jazakallah khair, all
Fikum
the
barakallah.
contributed as well and attended that presentation today. Jazakumullah khair. We'll see you inshallah. Assalamu alaikum.
Inshallah. Wa alaikum salam wa barakatuh.
Assalamu alaikum wa rahmatullah. Assalamu alaikum.